I'm going to try to break this down as easy as possible for anybody who is training themselves or their dental assistants or their team to get into scanning. Scanners are getting extremely popular. Every office, if not now, in the next few years is going to have a scanner. Impressions are being taken out for many reasons, but let's just face it, digital world scanner, if you're not there, you're gonna get there. Meaning that each and every assistant who is new to this field, sooner or later, is going to need to know how to scan stuff. I really don't like when people are jumping into it without understanding the basics and the science of how scanner works, where you can really go wrong with the scanners. People are not able to identify what's wrong with the scan. The most common frustration that I find when somebody's trying to scan is that they'll just say that, I don't know, the camera is not working. I don't know. So what I'm trying to teach is that I'm trying to take the I don't know part out of the equation, so that when things don't work, you want to be able to identify why things are not working and what you can do to fix it. But before we jump into that part, let's break it down into as simple as possible how scanning works, how a camera works, how the software works. Every person by now has seen a camera with a phone. Most cameras is going to have something which is called a panoramic picture. Understand the concept about how a panoramic picture works. You see this arrow right here, meaning when we press start, and a panoramic image means it's going to take a really long image. By doing this, it can keep going. When we stop, let's look at this picture. Why is it such a wide frame of a picture? Panoramic image doesn't mean that the camera actually really took an extremely wide image. What it really did is that it took a video series of a bunch of pictures together, and each picture, so let's say I take one picture, the video moves on, there's another picture. Not the camera, but the software is identifying half of your first picture and stitching onto your second picture, and the stitch keeps going on. That's how you get a panoramic video or a panoramic picture. Now let's look at the panoramic picture again. So when I start, this is exactly what the panoramic is doing, and the problem is it says immediately slow down, so it stopped taking. Let's go fast, slow down. Why does it say slow down? This is the most important part. Why does the software tell you to slow down? Because if you think about what I just said, you're not giving the software enough time to stitch the images together. Again, the camera's job is only to take pictures. It's the software behind the camera that is really attaching the images together. So if you took your pictures too fast, you're not giving the software enough time to stitch the images together, and you don't get a panoramic picture. This is really not meant for people who know how to scan. You already know it. You get the concept. You know how it works. This is really meant for, let's say, my assistant who is working today. This is her first day scanning it, and I'm teaching her how to scan it. This is really meant for people to understand how scanning works and how to do it right the first way. So if you ask my assistant, I will always tell them is that I'm not going to hand you this scanner until you understand the concept of scanning. If you really understand how this scanner works, and again, I use a Trio 6, you can use any scanner in the world. It's about the technology and the concept. It has nothing to do with what scanner I'm using. So again, don't think that I'm teaching you about a Trio scanner. Just think about any scanner in this world, any brand you pick. This is a camera. The more images you take, the software in the background is stitching things together, meaning every image you take, it needs to recognize a partial image of the previous picture to stitch the next image. That's how you get a 3D scan. Now the reason why I'm teaching this is that, let's say we are doing a test, this is a model, we start scanning. Believe it or not, even the reps who are selling this are going to teach you to go this way. And I hate to say it this way, but throw that thought out of your head. Let them teach you the wrong way. Don't insult them. Don't argue with them, because they're going to keep telling you is that, yes, this is how we recommend. Because they are not taught about the concept. They are given a scanner and say, go out and sell this. They are teaching you the wrong way, unfortunately. It's not my job to correct them how to really scan it. It's their education. I'm just teaching you how it's supposed to be done the right way. So remember, every scan that I'm taking, I am making sure that I'm not going palatal. I'm not going lingual all the way. Let's think about it this way. So the reason why that scanner stopped is because, again, I did not give enough time to stitch the images together. Now let's say I just did a palatal scan right now. Look at this scan again. Why do we think that this is a problem? If you look in the world of scanning, images stitching together, you took all the palatal scans. Now we are going to come back and then move it right here. What's wrong in this picture? You will think, and your scanner reps will tell you there's nothing wrong with this, but I'll tell you it's absolutely incorrect to move from lingual all the way and then come buccal, because you don't have any data or any image that is overlapping your lingual surface. So you should not move your camera palatal, come buccal, and then you're again coming buccal, because that's exactly why the camera stops, because it has now no frame of reference to connect these images together. So the software is struggling because you are giving incorrect data, and this is where things get messed up. Look at all this double image. You can immediately recognize the double image. Now the biggest mistake that people will do is that I already got a 639 image count. Okay, I got an overlap. What I have seen people starting to do is they're gonna start to like trim the stuff where there's double image. You know what? You made the matter worse. I will tell you from experience is that the moment you see a double scan, do not waste your time trimming anything. You're only going to make matters worse. Because again, now you're piling incorrect image on top of incorrect image, and you're only gathering bad data. It's no use for anybody. Your crowns are not gonna fit, your mouth guard is not gonna fit, you will order things from the lab, you will spend so much time adjusting things from the lab, you're gonna blame the lab that I had my most perfect ideal prep and the lab messed up. It's really not the lab messed up. I swear to God, labs are so hesitant to tell the doctors because they don't want to hurt your ego by telling the doc, you are wrong, you gave me a bad scan. They're just gonna work with what you gave them. They're gonna be so humble because they want to keep your business. You tell them, hey, your crown didn't fit, make a new one. They're still gonna be so humble. It's like, don't worry doc, we'll send you a new crown. Sorry that this happened. Just because, believe it or not, most people, they just don't want to hurt your DDS and DMD ego. Realistic as it is. I worked in a lab, I used to be a lab technician, I know how the labs work. Anyways, let's move past. You got a double scan, don't waste your time. I'm simply going to delete this scan. The moment I see a double image in my scan, start over. Because it's way faster, way easier to start over versus fixing a bad scan. All you're doing is wasting time. We'll also talk about how to position the patient, because that's one thing that I see again done very, very wrong. And we'll talk about that in the second part of the video. So let's start scanning again. This is a maxilla. I'm going to bring my scanner. So what I'm doing palatal, and immediately I'm going back, I'm going buccal. I'm going to move buccal, go palatal. So remember your concepts. The camera now has every image to stitch a previous image. So I'm not doing the buccal lingual rotation until I move on to my next frame and the previous scan. I'm giving each of my frame an opportunity to stitch together. Now that's my preliminary scan. I got enough data on my arch to get started with this scan. And look at the image count, 662. So, there is a reason why the reps or the companies will tell you why the image count matters. Image count matters, meaning if you took a full art scan and your image count is over 5,000, that means you took so many pictures. It's just one picture piling on top of the other. You don't get that why that image count is so higher, but as soon as you send that data to the lab, they're gonna run that on ExoCAD. ExoCAD will immediately have problems stitching images together because too high of an image count. Again, if you make one single crown, maybe this won't really affect you so much, but in the world of implant dentistry, it is extremely critical why every image count matters. You want a crown or an implant crown that just you take the healing abutment off and it fits right in, zero adjustments, you are happy, the patient is like, wow, this doc really knows what they're doing. Get your correct image count, because it's about the smallest level of precision that makes your chairside visits go smoothly. So the more you focus on the extreme basics, I'm talking about the most basic things ever, but it will give you a better chairside time and confidence with your patient. So again, let's look at the 662 image count. I got few areas of voids, but again, my software and my camera now has enough images that I can start wherever and just add images wherever I need to fill those voids in. It will move in much faster. Done. Under 2000 images is what I usually aim for. Again, it's not really a hard number, but it's enough for me to know that this is where it gives you a very consistent scan. Done. Post processing. If you understand this concept clearly, you're not going to have problems with scanning. And again, we'll do a series of videos where there are multiple issues that I often see when people are scanning without even realizing that these are the problems that they are making. And we'll continue with that. Thank you, Violet, for volunteering. Patient seated in the chair. I swear to God, how many times I see this. It's a very simple thing, but it's the most overlooked thing, and I can't stress this enough that I'm really focusing on the most basic things in dental office. I'm really not talking anything that's too hi-fi, anything that's not complicated, the most basic things which often get overlooked. Like for example, patients right here. All right, we're gonna start scanning for you. Nobody's noticing, but what's the biggest problem that we have here? Just come over this side. And I see this all the time. Look at the headrest position of the patient. That's not the comfortable. Any procedure that I'm starting, I am first looking what position the patient is seating. So lift your head forward. This is not seated according to the patient's height. Bring your headrest down. Again, every chair will have its own adjustments. Rest your head back. You see how much relaxed the neck is? You have the patient in a stressed position where they already are having their headrest sticking out. They're not comfortable. You're not going to get the patient to open up their jaw correctly because they are in an uncomfortable position, meaning the more uncomfortable the patient is, the more uncomfortable their mouth opening is, the more difficult or distorted your scan life is. So all these problems start from the most basic thing is chair position. Forget about the scanner, forget about this, focus on your patient first. Patient is comfortable, nothing personal, these are just the things that I look at, so this is why I'm teaching, right? I am seeing when patients are starting to scan. Let me pull up a test scan again. So now the biggest problem that I see all the time is that patients in the chair, okay, we fixed this. Okay, we're gonna start scanning with you. Open wide. Assistant is always like this, and we're gonna scan like this, like this. Look how uncomfortable I am. For whatever reason, people are not looking at ergonomics. I'm never gonna scan until, remember these basic stuff. Anything that has to work with the patient's mandible, most common problem, we are starting to scan the patient open wide, and we're gonna go like this and get the scanning started in a very uncomfortable position. Remember the rule of thumbs. You want to do any work on the mandible, we'll talk about sitting down position, but let's talk is that you're scanning, you're standing up. Rule of thumb when you're scanning or any work, follow-up, post-ops, anything that you're doing on the mandible, you want to have a good ergonomics, you want to be comfortable. When the mandible opens, it needs to be parallel to the floor. Open wide. So I don't see that this being parallel, so I'm going to lean the patient down a little bit, open wide. Now I can feel that the mandible is much more parallel to the floor, and now the height matters. And I will always say, again, everything can be customized the way you want, but I'm just talking about the general rule of thumbs. Mandible parallel to the floor, and the patient's shoulder needs to be at my elbow level. These are what I call rule of thumbs, easier to work with ergonomics. Now, stand in front of the patient, tell the patient, turn towards me a little bit, please. So again, don't go like this, have the patient turn. Patient is in a more comfortable position, I am more comfortable, turn slightly towards me, open wide, and I'll tell the patient always. It's a very common tendency for patients when they're in the dental chair is that they're gonna go like this. I don't know why. It is just a thing. So I will tell the patient always open wide and lift your chin up to the sky. Good. And now open wide again. And look how I am standing now and how I'm starting to scan. In a much comfortable position. So looking back at our previous video, think about the concepts again. Open wide, patient towards me, relax your cheeks now. Another important thing I'll always tell the patient, open wide, and the patient will always go like this. So you have to verbally tell the patients very clear in your words, open wide, hold the cheeks and say relax. You need to have finger in, retract the cheek a little bit, and this allows you to get access. So these are the little things that matter. I will always start by the premolar area, turn it facial, turn it lingual. Open a little bigger and now go back. So allow your scanner to push the tongue along so that the scanner is technically retracting the tongue along. and then I'm gonna go buccal like this. So I'm giving enough time for the software to recognize each previous frame. So now I'm coming buccal. Again, I'm gonna go back a little bit, turn lingual. Now again, I'm turning facial. Look at how my finger keeps retracting the cheek at all times. Again, I'm going buccal, lingual, buccal, lingual. My finger is still retracting the cheek at all times so that it allows enough space for the scanner to move around. That's it.
Wow.
Close. So this is me going at half the speed than what I usually will, right? So this goes much faster. Challenging part, distal of upper second molars. So again, we're gonna go back, step back a little bit. Let's look at chair position now. Think about this position the patient is. Open wide. Again, I can't see. Why am I doing this? We have the most expensive dental chairs in the world. We all know that how expensive those chairs are. There is a reason why they give a recline. Use it. When the patient or any procedure that you are doing for the maxilla, if you want to make easy ergonomics, maxilla should be perpendicular to the floor. Open wide. So again, if you look at the maxillary arch, it's more or less perpendicular to the floor. Can I lean down slightly more? Yes, I can. This automatically allows the neck of the patient to be a lot more relaxed because you're leaning back. It's going to allow them to open up the mandible. So when you're working on the maxilla, this is a much better position for me to scan versus me going like this. Second thing, let's talk about how high the patient needs to be. We talked about shoulder to elbow level. When I am working on the maxilla, I am usually going to keep my patient somewhere about the maxilla, same level as the elbow. There are times when I go as high as bringing the chair up to all the way to my shoulder level. I don't usually need to do that. That used to be an old denture concept. But the idea again is that I keep everything at my elbow level. Now again, how do we really start a maxillary scan? We all know in dentistry we use clock positions. So I always stand somewhere around 7, 8 position so that I'm about 45 degrees this way. If you're left-handed, you're going to stand same around that position, what we call 4 or 5 o'clock position. This is 7, 8 o'clock position. Have the patient turn towards me. Turn a little bit towards me, please. So, simple thing. Let's look at it this way. I told the patient, turn towards me. They will immediately look down. So, they are turning but looking down. Don't overlook these little things. They play a role. So, turn towards me and now chin up to the sky. See how the maxilla automatically became perpendicular to the floor. When the patient is looking down like this, all the hard work that you did, you lost the ergonomic position. Little things matter. Lift your chin up, open wide. Again, one of my finger is retracting. When the patient opens wide, now for video purposes, I want you to turn to the left a little bit, open wide, holding this. Do you feel that my finger is colliding against this molar? Meaning that the ramus of the mandible is going to get, and the condyle, when the patient opens, think about the anatomy. When the patient opens, the condyle and the ramus get close to the second molar and the first molar, so you do not have enough space for the scanner to swivel around. So the way you want to do this, open wide. I'm going to put one finger here so you can feel the mandible. That's where what I call tactile sensation, feeling matters. So feel it, feel how the bone is. Don't have long nails so that you're poking the patient there. Be gentle, be very easygoing with the patient, but you need to be able to feel. Now open wide. I have no space, so I tell the patient, relax your jaw. While the patient relax, I'm feeling. Now I can see the mandible going back into the rest position, and you can automatically feel my finger going in. Open wide, lift your chin up again. So I'm not starting with the molar area. Again, I'm starting with the premolar. My finger keeps retracting. We are going buccal, lingual, buccal, lingual. Now, when I come back to the molar, I'll tell the patient, relax your jaw a little bit. Relax, 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 relax. And now my scanner will easily slide back. And while the patient is relaxing, I'm going to turn the camera in. So I got the distal of my second molar. Now I bring it forward again. If the patient is relaxed, there is not enough mouth opening, so open wide. Good. And now you got back to the same position where you scanned in. I'm going to go to the front, buccal. Don't move all the way buccal. Come back, go lingual. Now I am also now moving to the other side, lingual, buccal. If you need to reset, stop, pause, check that scan. I got a very nice scan of one side of the patient's mouth. Nothing needs to be changed in it. Open wide, remember where you stopped, retract again. This little thumb is guiding my scanner. Little ergonomics matter. So this allows me to constantly look at the position where my scanner is scanning. I got a good buccal lingual scan. Same thing, open wide. So now this side of the mandible is colliding with the second molar. So when I go back, I'll scan palatal and I'll tell the patient, relax. So I can feel that they are now relaxing. That's enough room for my scanner to go back. And I'm coming back and done. So you can see the clarity of this scan, open wide, and I'm not even talking about a patient who has a very wide mouth opening. Limited mouth opening, normally what you see with the patient, these little changes in the way you scan, ergonomics makes a tremendous difference in your scan quality. These matters. I went pretty slow with it. If you really want to see a faster version of how this is really done, what I would do on a day-to-day basis, I'm going to delete this. We're going to start it all over again. Open wide, lift your chin up to the sky. Good. Stay open, buccal lingual. Now relax your jaw and open a little bit. Good. And open again. And relax again. So that's my scan, and look at the time here, 38 seconds, right? So I get this all the time from my assistants or whoever I'm teaching, is that you do it so fast. And I'll always say one thing is that the reason why I do it fast is because before I scan, I'm focusing on all the basic stuff that we talked about. Only then you'll be able to go this fast. You have the patient in the wrong chair position, you're holding things incorrect, you're never going to get this speed, because it has nothing to do with the speed or how fast I'm scanning. All the things that slowed me down played a role. Incorrect chair position, incorrect accessibility, incorrect muscle movement, incorrect retraction. All these things add up into image count, they add up into time. Also remember, a lot of patients have gagging issues. While the digital scanner is a tremendously helpful tool so that patients don't gag, the more time you spend, you are going to activate that gag reflex. The tongue is hypermobile. You have patients with a large tongue space, you spend 3-4 minutes into scanning, they're going to start to get uncooperative. They're going to start to give you trouble with scanning. So this needs to be done in a very prompt, timely fashion. However, focus on the basics. Can't stress that enough. Next part. So the more accurate you have your maxillary and mandibular scan, bite scan, second part. Keep the patient in the same position, open wide. Always use your 2 fingers, very gently retract the cheek, bite down. I am very vocal, very clear to the patient in the instructions. Bite down. I am always checking myself before I start scanning that the patient is biting correctly in the occlusion that I want. Then I will use these words. Do not open. Do not move your teeth. You can see how clearly I'm talking. While the patient is biting down, my thumb here is holding the mandible so that in the event the patient wants to move, I would feel it right away that there is movement from the occlusion. Again, little things matter. So now I'm getting my scanner in, 2 fingers retracting, and my mandible is constantly at the border. My thumb is constantly at the border of the mandible, so that any micro movement, I'm going to feel it and I know that my occlusion will be inaccurate. So I'm going to delete, start again. But if you are just telling the patient open wide, close, and you are just scanning, you have no idea whether the mandible moved, you have no idea where the occlusion changed, because again, you're going to scan the patient in that movement, you're going to send it to the lab. Now the crown is 2 millimeters high, and then you're grinding that crown for 2 millimeters. You spend 20-30 minutes chair side now to grind that crown, because again, you gave incorrect occlusion to the lab. You did not even know that the occlusion was incorrect. So it's the little things. Now come back to the other side, open wide. Now I'll retract, bite down. Again, my 1 finger always stays right here so that I'm scanning. and I can feel if there is any movement. So you have two hands, use them. There's a reason why dentistry is called four-handed, because you are supposed to make the most use of these things. So that's how you get a good scan. Thank you.
That's good. That makes a lot.
Why does details matter? We don't work with, like a 8 feet surgery. I don't know. I'm not doing a hip replacement. I'm not doing anything major. Even with implant teeth, we are working in millimeters, 8 millimeters, 2 millimeters, 10 millimeters. So if you're working in an extremely small precision based space, if I'm getting a crown and the width of my entire crown is 1.5 millimeters, cement space is 0.05 to 0.20 microns. That's how much cement space is. How much room for error do you think we really have? We don't. 1.5 millimeter, you have half a millimeter of an error. That half millimeter of a crown sticking up is 40 minutes of your chair side time grinding that crown. What's the patient going to tell first thing? It doesn't look the same. Why it doesn't look the same? Because if you made a Bruxer or a full porcelain or full thickness zirconia crown, we all know after, or at least most of us know, is that after the zirconia is baked, the glaze and the polishing is only about the less than half a micron or millimeter of the polish that goes on top. The moment you grind that crown down by half a millimeter, only the white opaque of the zirconia is going to show. So now immediately the color change, translucency change. Hairline cracks in porcelain are starting to happen. So the more you grind, you are losing the strength, you're losing the predictability of that crown. It all adds up to not just the patient, I feel it adds up more to the provider frustration. Because your appointments, all of them, imagine you have a crown insert at 11, you ran 40 minutes over. Now you're running over, every patient's late, your assistant lost their lunchtime, other assistant is burnt out, I lost time to eat, I'm cranky by 4 p.m., everybody is unhappy. Why? Because of half a millimeter of a mistake that was made in scanning. So it's those little details that add up to a predictable or an unpredictable day. So check, double check, understand how mistakes happen. It's not about mistakes don't happen. Heck, I had my own share of tremendous amount of mistakes and I learned from them. But identify to the smallest thing where things go wrong and it will help you to get better.